Hi everyone, Dr. Rich Castellano here, the Smile Doctor, and in this video we're going to talk about the basic concept of a growth plan for your practice. So what is a growth plan? May sound very simple. A lot of doctors don't have this. It is a written plan in black and white on what you and your team are specifically going to do to grow your practice. Now this is critically important. If your brain is saying, oh, it's a growth plan, it's simple, I can do that, I haven't done that yet, or I have a little plan, follow me through the whole video and you will find that the specifics will actually get you results that happen instead of results that are barely there or not there at all because the plan just fell apart. This is so important to be specific because it's about communication. Your team is starving for the right communication, and if they don't have the right communication, the right plan, they're going to start making things up. And it usually is not as good as what you're going to want it to be. It's not going to have the consistency. It's not going to have the quality. So it's critical to have this communication up front, written, and train it multiple times. This is also important to prevent the common mistakes that staff make over and over again. Have you ever had a situation where staff just seems to make the same mistake, or the quality of a certain process is just not that good, or patient flow in the office just never seems to improve? It's about communication. It's about having a growth plan and being specific about what you need. So how do you make a growth plan? Well, when I talk to doctors, I think one of the simplest things that you can do is I like to ask them, what are your top 3 goals and what are your top 3 challenges? Interestingly, a lot of doctors will say, well, geez, I don't know. They don't think about it. They haven't articulated it. Or they may say they want more revenue, they want more leads, and their biggest headaches are their staffing or dealing with insurance or whatever challenge, how to do better marketing. So they'll say, that was really helpful. That is, I do need to focus on those things. That's their mini growth plan. You can write out these basics and then flesh in the details. What is my growth plan? My goals, we want to have $450,000 in revenue each month, which means we need about $30,000 per day if we have 15 working days in the month. We need about 6 consults to be seen every working day with a 40% conversion, and we need about 12 leads to feed those consults. So we're very specific about the goals that we need to hit our revenue goals. Now, I also am focusing on the inventory in my practice, my surgical inventory. When the month starts, is there $500,000 of surgical inventory on the schedule, which means if we fill the schedule, would that create $500,000? If we fill the schedule with lower revenue generating procedures, maybe we only hit $300,000. Well, you need to look at this ahead of time. How is the inventory in your schedule? Are you allowing your staff to fill your schedule with high paying procedures? Or are they filling it with lower paying procedures that end up hurting your bottom line? That's an important goal for me, is the inventory. The third goal for me is marketing. I want to make sure I put out enough videos, patient videos, teaching videos, fillers, surgeries. So those are my goals. What are my challenges that we focus on in our growth plan? Attitude, number 1. Attitude of the doctor, attitude of my team, attitude of my patients. I am constantly trying to pump up my team, charge up my team, see my patients, pump them up, make them excited, make them understand that we're human and that we just want them to be happy. Attitude is a big challenge. Patient care is a challenge. Do I do a couple more syringes, maybe a few less? Is this patient good for surgery? Are they a good cardiac risk? Maybe they shouldn't do a procedure. Patient care is always a challenge, and we're always focusing on how to deliver the best patient care. And patient flow. Every busy office that you're going to visit is going to have some delay, things running behind. Well, you need to accommodate for that or prevent that whenever you can, and we are constantly focused on that challenge in our plan. Now, we have the specifics written out, and I invite you to do the same. What do you do in this contingency? What do you do here? And when you have written those things out, that is your basic growth plan, and you teach your team and you train them on this. Recognize that most practices don't have this. They're not focused and organized on their communication to their team, and it creates overwhelm with the staff, overwhelm with the doctor, and overwhelm with the patient. So I invite you to write out your growth plan, send it in. We'd love to share it with you and go through it and give you tips and feedbacks on what can make it even better. Thank you for watching this video. I'm excited to see your growth plan. I'm Dr. Rich Castellano. Don't forget, everything worthwhile starts with a smile, and I'll see you in the next video.